So thanks, Luke, for your kind introduction, and to everybody, welcome to the session. After the session this evening, I'm happy for the slide deck to be shared, so that way you're not required to take notes. So welcome. My name's Cherie, and I'm really passionate about digital health and its potential to improve the way that we can work in health and social care. And I've spent my career working both in healthcare and academic contexts, and I consider myself very much as a pracademic. So as a pracademic, I am interested in solving those real health challenges, but also embedding research and evidence into that work. So, it's very rare that we have a unique challenge in health, and there are many who have pioneered the way and have come up with evidence-based solutions to help us address the challenges that we face. So there are great opportunities for us to utilise digital health, but also many challenges. And what I'd like to do this evening is to share with you my thoughts around how digital health can enable a more equitable, responsive and sustainable person-centred health and social care system. So I want to share with you from my experience what works and doesn't work, my insights around successful digital health adoption, and demonstrate to you how digital health can advance and future-proof our healthcare system that we so highly value here in Australia, but also to demonstrate to you how digital health can contribute to the achievement of the Quintuple Aim, but more about that later. So thank you, Luke, for making an acknowledgement to country. I normally reside on beautiful Yaegl country in northern New South Wales, and pay respect to their knowledge holders for the care that they've taken of that beautiful part of the world where I'm lucky enough to live. So I'm going to start with a compelling case as to why digital solutions are necessary, and also how we might go about using digital tools and health information solutions to improve our health and social care system. So hopefully it's my intention to leave you with a better understanding of why we need to be using digital solutions to future-proof our healthcare system, but also an understanding of your role in that transformation. So that I can just get a bit of an understanding of what you would like to learn, I just thought it would be useful to do a quick poll just to get an understanding of how you rate your knowledge on digital health. Would you mind launching that poll, please, for me, Luke?
Yes, I've just launched that, Cherie. That should be on your screens now. So I can see people completing that. Excellent.
And what's that looking like, Luke? Because I'm working interstate, I don't have my...
You can't see that? Yeah, we've got about...
I don't have my two screens set up.
No, that's all right. So I'll just leave that open for another 10 seconds if anyone else wants to indicate a response. So we've got 58%, Cherie, saying seeking further skills and knowledge, and 38% as required for my role, and 3% prepare to be an ostrich in this domain.
Love it. Thank you. We'll keep that open. So what I'm going to do is talk about that current and compelling reason why we need to address digital health, look at the digital health landscape, talk about some of the future proofing and key strategies, and then look at the challenges and considerations. So I can see that many of you from the poll are familiar with digital health and its potential, and we'll check in again at the end of the session. But I just thought at this point it was important to get on the same page and talk about what digital health encompasses. And personally, I really like the simple definition from the World Health Organization, although there are many others. And the World Health Organization describes digital health as the application of technology to improve the health of populations. So it's a very broad definition, but encompasses the overall aim of why and when we should implement digital health solutions. So it's pretty fair to say that digital health is an umbrella term, and we use it to refer to the use of a range of technologies that can be used both to treat patients, collect data, and to share health information. So this might include, things we're all very familiar with, such as mobile health and applications, SMS reminders to attend appointments, which are absolutely marvellous, Medicare Online, check-in apps, and some of us utilise wellness apps as well. Electronic prescribing, a great innovation since the COVID pandemic. We've been able to use electronic scripts, electronic medical records, including our longitudinal health record here in Australia, My Health Record, telehealth and telemedicine, wearable devices, robotics, and artificial intelligence. So the compelling case for change is that there are lots of them, and we need to embrace digital health tools and solutions. When we're looking at some of the reasons why we might consider adopting digital health solutions, we recognise that our health system is under strain, where they cost, it's additional expenditure to purchase health information systems, but there are many reasons why we should be looking at digital solutions, including our ageing population, our increasing burden of chronic diseases, but also we are living longer. We tend to spend the majority of our health funding at the end of our lives, and we spend that in the most expensive component of our healthcare system, the acute hospital setting. We have seen the Royal Commission on Aged Care present weaknesses in governance, workforce, and safety, and we have known safety and quality issues across the health system, such as avoidable hospital presentations, provision of low-value care, and admissions, and we have a limited budget. Fall-related hospitalisations are estimated to cost New South Wales more than $1 billion by 2024 as our population ages. This suggests to deal with those increased falls due to our ageing population, the New South Wales government predicts that New South Wales will need an additional 300 beds to cope with the rise in admissions among residents aged at 65 years and older. There's also our valuable people resource. The health workforce is leaving in droves, and there is a desire for work to be more satisfying. And work in health, we know, can involve lots of frustration for time-poor workers. We can be faced with rework due to clumsy processes, systems and ways of working, and difficulties in communicating with our colleagues and across the continuum of care. The 2023 Intergenerational Report outlined that we're expected to live longer into the future and spend more time in full health. But the downside of that is we also have our population projected to reach 40.5 million by 2063. And we're going to have an increased number of centenarians, which is expected to increase sixfold by 2063. So quite a lot coming up, and we're already spending more and more of our gross domestic product on health. So consumers are also demanding digital access to their health information and find the current system difficult to navigate. Consumers demand more, with some users particularly wanting to be more proactively involved in planning their care and having choices. So preference for care in the home is a growing phenomena, and we're on the cusp of massive change with AI, machine learning already embedded in many of the tools that we're using in our daily work and lives. Digitisation of routine tasks such as making appointments through self-service. We also need to consider costs, and here in Australia we have a high quality and safe, cost-effective healthcare system by world standards, and we're lucky enough to have universal health insurance. However, we do not have an endless pot of gold to fund our healthcare system that we so value here in Australia, and we need to recognise and reduce waste in our healthcare system. Now, we know there is little slack in our health system, and we certainly can't work any harder, but we can work smarter. And we do know that there is rework, that there is waste through medication-related adverse events, readmissions, transfers of the elderly to the acute setting where treatments could be delivered in their residential or home setting. And we still ask people for the same information again and again, and et cetera, et cetera. So we also need to be thinking of sustainability from an environmental standpoint. And ironically, modern healthcare is a major contributor to pollution. This adversely affects human health. If we look at the health sectors of the United States, Australia, England, and Canada, that they combined contribute to 748 million metric tonnes of carbon dioxide each year. So if the health sectors of these countries were an independent nation, they would rank 7th in the world for greenhouse gas emissions. So we need to be looking at how digital and other solutions can help us to improve our greenhouse gases. And green IT is in the digital health space, is a space where we can make a difference, because green IT is taking a focused and proactive approach to minimising the negative effects of our IT operations, looking at energy usage, looking at the way that we manufacture, operate, and dispose of servers, PCs, and other computer-related products. So, digital health certainly needs to consider how we can contribute to a reduction in greenhouse gases and sustainability of our healthcare system. So, the current digital health landscape. This slide shows some of the challenges with our current system. I mentioned previously that consumers find it difficult to access health services. And in some locations in particular, it's very difficult to access general practice and other basic health services. There are a range of challenges that we face in terms of, adverse drug interactions and events. And a lot of those adverse drug interactions and events can be minimised by digital health, medication management, and other clinical decision support systems. So we know that certainly across my working life, that digital health systems have been evolving since the 1990s. And a lot of this has been driven by those advancements in technology that we've experienced. At the beginning of my career, we didn't use email, and the personal computers, the first wave of personal computers that we first had chips that were way smaller in their processing capacity than what we currently have in our mobile phones. So the adoption of health information systems such as electronic medical records has facilitated storage and sharing of patient information amongst healthcare providers. A paper record is very difficult to share information. It's very clumsy. Once information is structured and digitised, it has potential to be shared much more easily. We've also seen a rapid uptake in telehealth, and we now have virtual wards in many metropolitan hospitals, virtual ICU in rural and remote settings, and a lot more care and preventative care provided at homes through video consultations, remote monitoring, and virtual visits. So this is really important because it's increased accessibility to healthcare and been able to provide services and meet unmet needs in areas where previously they wouldn't have had access, for example, to a tele-stroke service. So this is a huge improvement for those remote and underserved areas. I think we're all, well versed with using our mobile devices to monitor certain aspects of our health, record our steps. Fitness trackers are very popular. AI and machine language technologies are being used to help with diagnostics. Blockchain technology, we know, can enhance data security, interoperability, and integrity in healthcare, and improve the management of health records. So on the horizon and already in use are digital therapeutics. So we can undertake digital therapeutics in the form of cognitive behavioural therapy. We can undertake wellness programs. But the rapid integration of digital health has also confronted us with regulatory and privacy concerns. So keeping up with artificial intelligence, cybersecurity is a major area where we are often lagging in terms of policy and systems to protect our valuable health information and data. Another digital technology that has massive potential and is already being used is as a result of miniaturization. So we now have in use swallowable cameras and diagnostics and other innovations. So while we've seen this uptake of digital solutions and health information systems, if we think about other industries, health has had a slower and more complex adoption of digital technologies. So there are good reasons for this. If we think about our banking, it's, continually being strengthened. There is a lot of investment. I think the Commonwealth Bank has 9,000 programmers in their Sydney head office. But the big three for me as to why health has had a slower uptake of digital has been investment, human factors, and privacy and security. So investment can be, banking, digital solutions are core to their business. In the health industry, where there are many competing demands, investment in an environment of cost and resource constraint on digital technologies is often problematic. The initial investment that we need to make in digital health technologies, so we're seeing across Australia, all of the states implementing electronic medical record systems, and in fact New South Wales is making a change from one platform to another. And this initial investment in digital technology can be substantial, and many healthcare organisations, especially smaller ones and those in the private sector, may lack the financial resources or IT expertise that's needed for successful digital health adoption. We also need to recognise that it can be more difficult to quantify benefits in health, such as safer care. So in health, it can be challenging to quantify the return on investment for digital health technologies, and healthcare organisations may be hesitant to invest in solutions without clear evidence of cost savings. We're also stuck with investments in legacy systems. Some 20 to 30 years ago, a system was implemented in Queensland called Hibiscus, which was a suite of products and including a patient administration system. And a colleague of mine's daughter the other day mentioned that Hibiscus was still in use. It's been planned for succession for quite some years. So those legacy systems can make it difficult to transition to newer solutions without incurring significant cost and disruption. So human factors, I think, too, usability of health information systems, resistance to change, implementing digital solutions can disrupt established workflows and may require substantial retraining. And training and education is something that, sometimes doesn't get the attention it deserves. We work in a highly mobile workforce in the healthcare industry, and that training needs to be appropriate to the setting. It needs to be tailored to the specific clinical settings that people are working within, and it needs to, although I would also argue if our systems were usable, training would not need to be as intensive as it currently is. We also have health security concerns around data breaches, and the fear of data breaches and privacy violations can lead to hesitation in adopting some of those helpful digital health solutions. So there's a range of factors that contribute to the slow uptake. And if we look forward to what an ideal digital health system might look like, according to the Australian Digital Health Agency, safe, seamless and secure evolving health and care to meet the needs of modern Australia is characterised by avoiding hospital admissions, reducing those adverse drug events, better informing treatment decisions and options, and importantly, better coordination of care for people with chronic and complex conditions, as well as reducing wastes and duplication of medical tests and diagnostics. At the global perspective, the World Health Organization encourages a range of principles for the development of digital health systems. And you can see in this diagram here, that digital health solutions should address a specific health need and have the patient or people at the centre of any digital health solutions that are being explored for implementation. So if we're focusing on meeting those needs of individuals and communities, if we have people at the centre, we ultimately also want to aim to empower individuals to participate in their own health and healthcare. If we can integrate solutions with our existing systems, then we're going to be able to leverage greater coordination and improve coordination of care across the different components of our healthcare system. And I mentioned earlier that evidence-based approach. So the adoption of digital health technology should be based on evidence and evaluation. We don't want to be looking at unproven solutions or solutions that aren't going to have an impact on health outcomes, and having in place those important monitoring and evaluation frameworks to assess the effectiveness and safety of any digital health interventions we're exploring should be front and centre. I mentioned earlier about sustainability, but another aspect is scalability. So we need to be able to scale solutions to accommodate varying population sizes. We certainly don't have a one-size-fits-all healthcare system, and what works in a large metropolitan tertiary referral hospital isn't necessarily going to work in a small rural and remote location. So scaling our solutions to accommodate varying population sizes, being adaptive to evolving technologies, and also being able to sustain systems in terms of financial feasibility, long-term maintenance are important factors to consider. Capacity building, obviously as an educator in a university, this is something that's front of mind, and health professionals and other stakeholders need to be involved in digital health, selection of digital health tools, should also receive adequate training and support to effectively use those tools. Too often we see tools implemented and there's little background understanding of why it's been implemented, how it's going to make work easier, faster, safer for the health workers who are being tasked to utilise them. So another complex challenge with any digital solution or new health information system is human factors. And it's been reported that up to 70% of information systems and digital health projects fail. And from my experience of implementing health information systems, if we are wanting to do that successfully, we should use digital to solve real challenges. We don't want to burden our health workers with additional processes, and tech solutions should make work easier, safer, faster. And we can use proven methodologies to help identify the causes of problems and determine whether there is a role for digital solutions. So service or clinical redesign are two proven methodologies to help identify solutions to some of the real problems that we all experience working in the health and social care industry. So I think interoperability and information sharing is key. There is a lot of time and resources wasted by missed communication, delays in sharing discharge summaries and other important communication, as well as duplication. We should also recognise that data and information are valuable assets, as valuable as our other assets in our health and social care organisations, such as buildings, finances, our human resources, and that we should treat those assets as we do other organisational assets. When we're asking our colleagues to use new technologies, they need to be supported with in situ training and education. Training doesn't stop. Human-centred design principles are key when we're approaching any digital health implementation. But looking at training and education models that are adaptive to the specific situation. So emergency department clinicians have specific requirements, regularly use certain parts of the system. So adapting that training to those situations. Involving users is key, and usability in most age groups. We know that if you're under 60, you're pretty well savvy in using a mobile phone. No one teaches us how to use our mobile phones usually. We're using technology that is intuitive. The interface is easy to find our way around. But that is not always the case with our technological solutions and health information systems that we use in health and social care. And change management and clear messaging around why the solution has been selected, how it's going to help you to improve your workflow. Clear messaging and change management throughout any digital implementation is crucial. So a key learning from my career in health and as an academic is the technology acceptance model. Now, there are many subsequent models since the technology acceptance model was introduced, but, it's an oldie but a goodie. And we use digital tools in our personal lives to use appointments and manage our fitness. And often we find in health that the tools that we utilise can be difficult to understand and not as usable as they could be. And the technology acceptance model is a really simple model that explains that there are two reasons that determine if an information system or technology will be accepted by potential users. So the reasons are the perceived usefulness of the system to them and their work or the task they wish to complete, and the perceived ease of use. And this is a really simple lens to examine any discussion around the introduction of a new technological tool or health information system. So in the promotion for the webinar, I mentioned the Quintuple Aim, and I must deliver on my promise to bring this all together for you. So for a number of years now, we have spoken about a framework called the Triple Aim for healthcare, and this has come out of the Institute for Healthcare Improvement in the United States, and which was led by Donald Berwick, a guru in the quality space. So this original Triple Aim has now evolved to 5 to optimise health system performance. So the Quintuple Aim includes working towards improving patient experience, improving the overall population, health of the population, reducing healthcare costs per capita, and also now includes clinician wellbeing and health equity. So if we're thinking about working towards these broad aims, leaders can consider how technology can help to achieve them. So if we think about digital health solutions, if we can keep the Quintuple Aim in mind, digital solutions should aim to improve patient experience, lead to better outcomes, lower costs. We don't want to be creating additional burden or fatigue for our clinicians, but also considering equity. So, when we're thinking about equity in digital health, we're thinking of that fair distribution of digital health technologies and resources, and being able to ensure that all individuals, irrespective of their socioeconomic status, geographic location, or other demographic factors, have equal access to and benefit from digital health innovations. We want to narrow the digital divide and not widen it. So what are some of the key strategies for future-proofing healthcare? I think it's fair to recognise that digital is part of our future. We all need to be involved to make digital work. We certainly don't want to digitise poor workflow or models of care that are not working. We need to put consumers at the centre, and it's important that we present realistic benefits to users. Too often we oversell the benefits and then are unable to deliver on those benefits. So for some, unfortunately, digital health will be an increasing part of our roles working in health and social care across Australia and globally. And we now see significant work in progressing digital health agendas across Australia and across the world. So I just thought I would finish with an example of provisioning digital solutions with people at the centre. So many health organisations are already working towards a digital front door in their organisations, and this is an excellent instance of design and provision for consumers. So a digital front door offers the use of digital technologies and online platforms to improve patient access with and to healthcare services. And we're already familiar with many of these where we can access portals to access healthcare services, schedule appointments, communicate with their healthcare providers from your own device. And this makes our healthcare more accessible and more convenient. Digital front doors stream administrative processes. We're often asked to, input some of that basic data collection before we even arrive at our appointments. And this can also reduce the need for in-person visits and saves care for both patients and healthcare staff. We can also use digital front doors to personalise our interactions and receive tailored information, reminders. We can be sent treatment plans through digital platforms. And this fosters a more individual approach to healthcare, considering individuals' needs and preferences. Online portals allow us to communicate with our healthcare providers. We can ask questions, we can stay engaged in our care, but also access timely information. We saw this done quite well during the COVID pandemic, where we received notifications around different requirements at the time. Remote monitoring is now being widely used to monitor patients, allow for early intervention, improve disease management. And, telehealth can be a cost-effective solution. It can reduce travel, particularly for those in rural and regional areas. And overall, a digital front door can contribute to more streamlined operations, reduced waiting times, and better resource allocation, and subsequent efficiency of our health and social care system. So I think it's fair to say that we all need to learn about digital to do our jobs effectively and to be able to identify where digital solutions might make our work safer, easier, and faster, and more sustainable. And most professions now have digital health capabilities included. I know my profession, the Australian College of Health Service Management, has a set of digital management competencies. So I'm hoping this evening that I have shared with you how digital health can enable a more equitable and responsive, sustainable person-centred health and social care system. So I'd just like to share a couple of resources for those who are wanting to learn more. This is an open educational resource, which means it's freely available. It's a text on leading in health and social care that has 2 chapters that are relevant to our webinar this evening, or our masterclass this evening. So please, once the slide set is made available to you, avail yourself to those chapters if you're interested in learning more. Luke, I'd just now like to just check in on a poll. If you're interested in learning more, Luke outlined a range of options to prepare yourself to work in digital health, including the certificate and master's pathway. But we also have micro-credentials and short courses in digital health that'll be available in early 2024. And we have a very popular graduate certificate in digital health that covers off on privacy and security, health data analytics, electronic health records, and an introduction to health informatics. So, Luke, I'm just wondering if you could maybe share or launch the poll.
Yeah, the second one.
Thank you.
There we go. So I've just launched that.
Thank you.
So yeah, please jump in and indicate your response. Great. So they're coming in thick and fast. So it looks like we've got just over 50% around recognising the importance of digital health and my role. About a third seeking further skills and knowledge in digital health, and about 13% around, I consider my knowledge in digital health as required for my role.
Do we have any ostriches still?
No.
Oh, fantastic.
No. You've done well. So I'll end that one now.